My name is Henry. I'm a program director at the HENAR Foundation. Today I'm going to talk about two things briefly. What a community health worker program is, or who a community health worker is, and then what the HENAR Foundation is doing in Syunik, Mars with our new community health worker program. So first, to define what is a community health worker, or CHW. So the only WHO requisite for who a CHW must be is that they have to be from the community that they're serving. Their education level, their familiarity with healthcare can range from no formal education at all to healthcare professionals who are looking at different positions or are out of work. CHWs are really a vehicle to deliver healthcare access. They're a very versatile intervention, and I'll go through some global examples. So really our program functions to bridge gaps in villages through a home visit model with CHWs from said villages alongside community health nurses or village nurses working to bridge gaps in fragmented primary care systems. So a little more on who CHWs are and what they do. So if you look at the triangle on the right, these are the three things that the CHW model brings to any healthcare system. Fundamentally, they improve access. It is a very cost-effective and high return on investment intervention where you hire people who are otherwise unemployed to do home visits, to accompany people to clinics, and to provide a lot of psychosocial support, driving behavioral change, and ultimately enhancing health outcomes and impacts. If you look at a lot of these sort of fancy primary care and primary health care indicators and frameworks, CHWs are starting to make their way into key levers that the WHO and groups like the Primary Healthcare Performance Institute consider essential for a healthcare workforce. We have some visuals on all the things that CHWs can do and do in Armenia and elsewhere, ranging from early detection and screening to sort of more soft skills such as trauma-informed care, all in the model of social accompaniment. So not strictly doing biomedical interventions, but rather just bridging the gaps and standing with people as they seek healthcare. I talked a little bit about this new model and how it has been globally successful. I think there's two ways of thinking of CHW programs. They can be horizontal, right? So for example, in Brazil, the Palestinian territories, Kyrgyzstan and Georgia, you've had examples of CHWs doing a little bit of everything under the sun for primary care, connecting people to their family medicine doctors, checking blood pressures and blood sugars, or you can have very vertical health or pathology-specific interventions. So for example, in Peru, there was a national intervention where you had one CHW per patient in the tens of thousands. They identified that there was MDR and XDR tuberculosis that was running rampant in the whole country, and they scaled that up to a national level, and Peru has now some of the best TB outcomes because of the CHW intervention. So CHW is a diverse intervention model that can do many different things. So what is the HENAR Foundation, along with our partners, doing in Armenia specifically? So our biomedical focus is chronic disease, so diabetes and hypertension. But really, I think the essence of the program is focusing on psychosocial support and mental health, because those two pathologies are syndemic to stress, right? And then on top of that, increasing access to healthcare. So we have partners in the room that we work with, including OFAR and the State Health Agency, to respectively deliver oral health screening and then a preventative screening plan as well. So really it's a vehicle to deliver diverse interventions, as I've mentioned before. Currently, we work in 4 villages in Sisyan-Goris area, Akhlatian, Shake, Kornizor, and Hartashan. And we started the program by doing focus group discussions in said areas and scaled up over the course of the last 2 years. To do things in triplicate, again, our CHWs focus on 3 interventions, biomedical interventions. So what does that look like? They go to people's homes and they check blood pressures alongside the nurses, and sometimes the nurses check blood sugars as well, so looking at diabetes and hypertension. They do community organizing in the form of medical days or awareness events, And then this is all under a trauma-informed care or psychosocial training approach. So using very sensitive language to understand the stress that surrounds these communities. So really filling the gaps that we see due to not enough workforce, people not having polyclinics or ambulatories in their villages specifically. We collect data on everything that we do, and that's under the purview of the nurses and the CHWs themselves. So again, many different elements to what is a very horizontal approach towards primary care in these rural settings. So let me conclude. We are expanding to Tatev area with 3 new villages in Nurk and Panzresk in the Goris area as well. So we'll be expanding today. We're actually starting our first trainings in these areas. So I'm happy to talk to anyone who is interested in learning about CHWs more, what they're doing in Armenia.